Hello there folks, my name's Rachel and I'm a student nurse. This is a revision guide on pharmacokinetics and the ADME of some commonly used drugs. I've put this together as part of an examination that I have and I think it's a really useful revision guide. So I've also highlighted on there some of the basic information, and then anything that's not highlighted is additional information if you've got similar assessments yourself or it's something that you're just wanting to learn a little bit more about. Okay. So the objectives of this PowerPoint is to explain the way the drug enters and is distributed around the body, to explain how the drug is metabolized and excreted from the body, and also to explain any potential toxicity or severe long-term side effects and how you may detect these. So the first drug we have here is ACICLOVIR. The absorption of it is generally poorly absorbed. Orally, it's around 10 to 20%, and in the GI tract, the creams are less than 1% to 9%, and that's through the skin. Ophthalmic ointment is minimally absorbed. The distribution, it's into the tissues and the body fluids. It's 9 to 33% protein bound to plasma, and the volume of distribution is roughly 0.6 litres per kilogram. The metabolization is intracellularly, that's a mouthful, in viral infective cells, and minimally in the liver, where it's biotransformed into enzyme groups 8 and 9. The excretion is the majority of it is excreted in the urine, 2% in the stool, and less than 1% in CO2. The toxicity in creams and ointment, it's unlikely to cause any harm. 20 grams in a single occasion or exceeding the recommended dose over several days is considered toxic and an overdose, so medical attention should be sought. Also, high doses without fluid and electrolyte monitoring can be toxic. Symptoms can include lethargy, agitation, seizures, coma, and renal trouble, such as reduced output. Long-term side effects, there's no important long-term side effects that have been noted. The next drug is paracetamol. The absorption, it takes place in the GI tract. It's 30 minutes to 2 hours peak plasma concentrations after ingestion. The distribution, it's evenly throughout the body except the fat, at the rate of around 0.9 litres per kilogram. Negligible protein binding and is around 10% to 20% bound by red blood cells. The metabolization, it's metabolized in the liver mainly by glucuronidation and sulfation. Excretion, it's eliminated in the urine, and only around 5% of the drug is excreted unchanged. Paracetamol toxicity is 10 grams ingested over a 24-hour period. People are advised to seek medical advice. Symptoms of overdose can include bloody TARRY stools, signaling bleed in the GI tract, decreased urine output, indicating kidney issues, and also with all the drugs as well. I've put ANAPHLAXIS shock on there as well, because it can be toxic. Each drug can be toxic to a different individual, depending on if they have allergies to certain ingredients within that, and therefore generate an automatic shock and go into an anaphylactic state. The long-term side effects, some studies have shown that people with high BP are more at risk of heart attack and stroke. The next one is ibuprofen. The absorption, it's absorbed very well orally in the upper GI tract. 1 to 2 hours, you'll see peak concentrations there. The distribution is rapid throughout the whole body, and it's plasma binding approximately 99% at the volume of 0.1 litres per kilogram. Metabolization, it is biotransformed in the liver to the formation of major metabolites. And the excretion is 99% in the urine and 1% biliary excretion of the unchanged drug. The toxicity, so more than the maximum recommended daily dose, which is 400 milligrams, no more than 3 times a day. That is considered a toxic amount to seek medical attention. Under doctor supervision, people may have 600 milligrams 4 times daily and long release capsules, but again that is under supervision, and we're talking about an adult dose here. Also, it's available in creams, but the advice is to refer to manufacturing leaflets on that, depending on the dosage. Symptoms of overdose can include GI upset, dizziness and mild sedation. Long-term side effects, stomach ulcers can occur, and pain in the upper GI tract, tarry stools. Doctors or practitioners can prescribe acid inhibitors to protect the stomach lining. Also, long-term other symptoms of that can be kidney issues, ankle swelling and reduced urine output. The next drug, fluoxetine, the absorption, it's absorbed in the GI tract and taken orally. The distribution, it's highly plasma bound, 94%, allowing the drug to be distributed to get to the brain at a rate of 20 to 40 litres per kilogram. Metabolization happens in the liver, where it converts to norfluoxetine by enzymes, and the excretion is primarily in the urine following a process of glucuronidation to facilitate this. Fluoxetine, the toxicity, it's rarely toxic alone, but serotonin syndrome can occur, as with all SSRIs, so symptoms can include nausea, agitation, dilated pupils, tremor, tachycardia, convulsions may also occur. And the long-term side effects are sexual-related side effects. And amoxicillin absorption is 70% bioavailability absorbed in the small intestine, although 48 to 72 hours is usually the time frame before infection symptoms begin to subside. Distribution is 17% protein bound, and it's rapid throughout most of the body's tissue and fluids. Metabolization is incubated within the human liver microsomes, and several metabolites undergo various transformations, including glucuronidation and chain oxidizations. An excretion excreted in the urine with negligible amounts detected 12 hours after the last dose has been taken. Toxicity of the drug, then anything above the recommended limit as prescribed to seek medical attention, and overdose symptoms can vary in individuals. So this can include pale stools, renal failure, decreased output, hematurea, which is blood in the urine, hyperactivity or a rash. Long-term side effects can include bacterial resistance, and then obviously, if there's been some problems when taking it with an overdose, that could then have a knock-on effect and create long-term renal problems in the foreseeable future. Next up, propananol. The absorption is rapid and completely absorbed. Main absorption site is the colon. The bioavailability varies due to extensive first-pass metabolism mechanism. The distribution, it's 90% plasma bound, and it's distributed into the body tissues, including the lungs, liver, kidneys and heart, and the rate of distribution is around 4 litres per kilogram. Getting hard to say this now. Metabolization, the first pass is rapid first pass by the liver, mainly by glucuronidation and side chain oxidation, which is the processes within the liver that facilitate the metabolization of propananol. And then excretion, it's excreted in the urine as metabolites. The toxicity, anything above 1 gram is considered lethal, single doses that is, and symptoms can include low blood pressure, passing out, slow pulse, so bradycardia, liver and kidney problems as well, so it could be reduced output, blood in urine, pale stools. Okay, and then the long-term side effects, the negligible with beta blockers. However, some studies have shown neurological symptoms. However, these subside following withdrawal. Lactulose, so the absorption taken orally or rectally, less than 3% absorbed in the small intestine and the remainder absorbed in the colon. The distribution, this sits around the GI tract if taken orally, but negligible amounts distributed around the body. Metabolization in the colon by colonic bacteria undergoing transformation into fatty acids, hydrogen and methane. Excretion is mainly in the stool, but around 3% of it is renal excretion. Lactulose, the toxicity of it is there's no specified dose stated for toxic level, but overdoses may include nausea, cramps and diarrhea. This can be treated with electrolyte replacements. Long-term side effects, if used longer than required, then can cause electrolyte imbalance, and symptoms of this can be muscle cramps, weakness and seizures. DIGOXIN. So the absorption is around 70 to 80% is absorbed by the body, mainly in the small intestine. Bioavailability varies between 50 to 90%. However, oral gelatinized doses have been known to have 100%. Just a little note there, though, that gut bacteria weakens the dose. The distribution, it extensively is distributed into the body tissues, and high concentrations in the heart, kidneys can be found, but largely in the skeletal stores at a rate of around 175 to 500 litres is the rate of distribution. The metabolization is the small amount in the liver and by the P450 enzymes. The processes include glucuronidation and sulfation. Excretion, the main route is renal excretion, and nearly all that is in the urine remains unchanged. Digoxin toxicity is factor dependent. It could be that somebody's daily dose has become toxic to them, or they've taken more than has been prescribed. Symptoms of toxicity include irregular pulse, fainting, tachycardia, confusion, visual changes and some foot or ankle swelling. Long-term side effects, there's none really noted, but stopping suddenly can change the heart function. Okay folks, that's the end of the revision session now. I would just ask if you found it even the tiniest bit remotely useful to just give it a little like, because I found that there wasn't much out there visually, and I am quite a visual learner, so I thought, why not share best practice and ideas and that, with other people who are either training or wanting to know a little bit more about the subject. If you could subscribe as well to the channel, I'm going to be posting lots of different things on here, health related, but also it is a quiz channel, so there's going to be some just for a little bit of fun quizzes on there which are general knowledge, but there will be some health related ones as well. I know it's obviously not perfect, and you'll probably notice loads of typos and that in there, but I just wanted to get this uploaded just so I can listen to it as well, because I've got an assessment tomorrow, and then for anyone else, and I hope it is a little bit useful. Okay, thank you, good luck with your studies and the rest of your careers, and yeah, hope to see you soon. Thank you.